Hi, Dr. Garima here. I just sat to shoot this video like 20 minutes ago, and since then I've just been on call. Some of the other person is calling. Anyways, let's just quickly get done with this. Another SBQ question of Australian Dental Council exam. Important one. Surely you'll get one of these questions which are related to teeth issues. Uh, Before solving this question, let's do a little bit of theory to brush up your basics. The difference between attrition, abrasion, abstraction, and erosion. All these forms are loss of tooth structure. The major loss of tooth structure that we normally encounter is caries, which is a bacterial loss of the tooth structure. But there are other forms of tooth structure also lost, which happens due to various other multifactorial conditions, and they also produce the same symptoms, pain, sensitivity, etc. So you have to treat, but you need to know the cause so that the same thing doesn't happen again in other teeth. So let's just start by understanding what is erosion. Erosion is loss of tooth structure caused by acids other than those produced by bacterial plaque. Now, those acids can be a lot of soft drink consumption. It can be gastroesophageal reflux disease. But in that scenario, mostly the palatal or the lingual portions of the teeth structures would be damaged because when you constantly have reflux, these are the surfaces, the palatal and the lingual surface is the one which gets affected. Soft drinks will cause erosion of the labial surface. Then affected area anywhere but certain pant is uncommon. That's what I said. Etiology is dietary or gastric acids. So how the questions in ADC would be asked to you is that now you have to understand why gastroesophageal reflux disease is there. Either it can be hereditary, but 99% it's associated with a lot of stress, or in patients with bulimia nervosa, right? That is a condition where you eat lots like excess, and then you have this disorder where you feel you're going to put on fat and you should not have eaten so much that you go home and you vomit. So again, the acids come out. Not a great condition to be in. There is some psychological distress that is going on in some patients, so you have to understand. And then because they have the stress, they end up taking antidepressants, which is again a very common question asked in the exams. A lot of candidates make a mistake when the question is asking what is the cause of dry mouth and the option mentions medications. They choose to mark medications instead of stress. See, stress by itself creates a dry mouth. You understand? Imagine your situation if you were in intense stress. You don't salivate, you feel your mouth is dry and you want to drink more water. So, stress causes dry mouth. To combat stress, you take antidepressants, but not all antidepressants cause dry mouth. Certain ones will cause dry mouth, and they have to mention that certain name of the medicine, then only you can choose that in the option. If I just say the medications that the patient is taking and neither the question mentions which medications, it just mentions antidepressants, but you don't know which one, then you cannot just mark medications as the option for dry mouth. Okay, if the one of the options is given as stress is the answer, that is the cause of the dry mouth. You understand? Then you have Jogren syndrome, which again will cause dry mouth. So anyways, we are talking about erosion, so let's come to that. I just went off a little lateral topic since we were talking about this. Attrition. What is attrition? Attrition is tooth to tooth loss of tooth structure. Usually happens in the occlusal and the incisal surfaces. And naturally, attrition starts about the age of 35 years. And in bruxism, there's severe loss of the teeth structure. So attrition will happen tooth to tooth loss, and it also happens proximally, as each tooth is moving in a different direction when you're biting. The proximal contacts also rub against each other, and slowly, the width of the tooth starts to decrease. You must have seen in very old patients who have had a lot of attrition proximally. You'll see all the teeth are kind of straight, they are not bulbous and contoured because of the age the attrition has happened. Abrasion. Abrasion is loss of tooth structure caused by rubbing by an extrinsic object, which can be your toothbrush, which can be tobacco, which can be your fingernails like this, or keeping a pin or something. It's usually cervical, but it could be anywhere. So, if the question mentions the patient is having a very hard toothbrush or doing some form of friction on the teeth, then abrasion. Abfraction. See, abfraction is located like really cervically, very close to the gum line, and it's a sharp V-shaped defect. Why it happens? It can also happen due to toothbrush abrasion, erosion in that area, but mostly, basically, they are micro cracks, and trauma from occlusion will create more of it. So I'm sure in a lot of patients, you must have seen those class 5 cavities, In certain patients, they are just a saucer shaped. That is abrasion. But in certain patients, you'll see a very sharp V-shaped defect with the bottom of the V inside, like towards the center. So that sharp V-shaped defect is abfraction and not abrasion. I have a cross section and I will show you. So you see this abfraction from the side is like a sharp V-shaped defect, while as abrasion is just a shallow area. You understand? So whenever there is abfraction, try to see if that tooth is coming in a premature occlusal contact, because you might tell the patient, you know what, you're brushing very hard, and maybe that's not the cause for that. Maybe it's the trauma from occlusion, and that you need to figure that out. And erosion is like the complete dissolution of the surface layer of the enamel, like it's a flat, smooth, shiny appearance. So I hope once this is clear, now when we'll jump to the question, you'll be able to answer it more properly. A 35-year-old patient presents at your clinic complaining of teeth sensitivity. Whenever a patient says there is sensitivity, that means somewhere the dental tubule is exposed. Now you have to figure out why it has been exposed and how you're going to treat it. He works as a manager. He drinks 3 glasses of wine and smokes 40 cigarettes per day. Wow, that's huge. That's a lot. He states that his teeth are particularly sensitive to cold food and drinks. What is the condition shown in the picture? Now, we just discussed about the conditions. It's erosion, and they have shown the palatal surface. We know he drinks 3 wines and 40 cigarettes. So much of smoke, definitely, and he's a manager, so probably he's under a lot of stress, and that is why to combat it, he's doing it, and then that becomes a habit. So this condition is for erosion. It cannot be abrasion, abfraction, attrition, or occlusal traumatism. Like when you see multiple teeth affected, having the same pattern, shiny appearance, and the entire layer of the enamel conked off, it has to be. Yes, there is chipping off out here. That can be due to some other reason. What is the mechanism behind those lesions? Also, one thing you need to understand that these pictures that we have put are similar to the ones we see in the exam, okay? You cannot get the exact same picture of the exam. Like, of course, you don't have access to their database. So these are almost like 80 to 70% similar pictures. But in the exam, whatever picture has been given would be very, very definite. And the question would be asked according to that. So, though we get the question correct and the options correct, which itself is a huge task to get, because whoever has given the exam or whoever is about to give the exam, you don't get the question paper outside. So, you just have to remember and make it. So, yeah, whenever you see the picture, assume this is 80% of that of the exam, and you'll get an exact picture in the exam. So, here the answer is erosion. What is the mechanism behind those lesions? Okay, so assuming you have marked erosion, then you will start thinking, okay, what is the mechanism behind those lesions? Erosions are always chemical loss of tooth structure. If they were bacterial loss, then that would be caries. If it was mechanical loss, then I would classify it as attrition or abrasion. Understood? What systemic factor may commonly be associated with such conditions? Systemic factor. Asthma, long-term inhalation of certain asthmatic drugs can result, but since they have not mentioned asthma by itself will not result, it's the inhalation of those puffs that might result. Hepatic conditions, psychosomatic conditions, gastroesophageal reflux disease, yes, and diabetes mellitus. So, for the other conditions, it's usually the medicines that you prescribe would cause, but the reflux is the actual direct cause of erosion. Which of the following also has to take part in the patient's condition? Xerostomia, enamel hyperplasia, fluorosis, stress, and all of the above. Stress. We discussed about it, right? You could have said xerostomia, but the patient didn't complain of dry mouth. If the question had mentioned the patient is having dry mouth, then we could have probably went with xerostomia. But no, it's the stress. Usually, your patients appreciate your devoted service, and so this is a very important question, and you'll get ethical questions, at least 5 to 10 of it in your exam. Make sure you mark them correct. If you mark the ethical question wrong, there are high chances of you not clearing the exam. Usually, your patients appreciate your devoted service and are happy to let you decide what treatment they will have. But this patient resent what he considered to be your paternalistic approach and the lack of information about treatment options. Okay, this particular patient feels that you are not aware of the treatment options. He asks you for a referral to a prosthodontic dentist. You refuse because it is your professional opinion that it is unnecessary. What is the ethical view of the situation? See, what this question basically is saying that normally, whatever so first of all, you have to understand the ground rules of Australia. You cannot just directly book an appointment with a specialist, okay? Unlike our countries, right? Here in India and in Dubai, I can just Google up the nearest prosthodontist, orthodontist, I can directly walk into that clinic. But in most of the other Western nations, they don't follow that practice. You have to go to your general practitioner first, regardless you want or not. You have to, and then you have to pay them. And then, if you want to visit a specialist, you have to tell them that give me a referral. So that doctor will refer you to a specific specialist, and then once you get an appointment after a few months or so, then you will go and visit that specialist. You cannot directly go to that specialist. So, for example, if I go to a general dentist and I tell him, you know what, I think there are more options available, but I think you're not aware of it because you're not the specialist. I wish to visit a specialist, so give me a referral. So, my general dentist, so what the question is asking is, what is the obligation of the general dentist? Can the general dentist tell me it is not necessary and that's why I'm not going to refer you? Or the general dentist should feel that no matter what he is thinking, it is my ethical right to ask for a referral, and because I'm asking as a patient, he should be giving me one. Or he should tell me that he has a right to refuse the referral, or none of the above. So, legally and ethically, if a patient is asking for a referral, the general dentist cannot refuse. So, this is how it should be ethically, and that is what is mentioned in the ethics. And that is what the question is asking, that the patient is asking you for a referral and you refuse because it is your professional opinion that it is unnecessary. But what is the actual ethical view of the situation? And now the options are there. You have the right neither to mention or refer patients to for treatments that you consider unnecessary. That is a wrong option. Your conviction that your principles should take precedence over those of your patients is contrary to the growing legal and ethical consensus that the patients have the right to make decisions about their healthcare. That is true. So, if I'm the general dentist and I believe that my opinion should be superior to my patient's opinion, then that is wrong. So, according to the ethical and the legal obligations, if the patient is asking for a referral, regardless I feel it's right or not, I should be referring that patient. This is what it means, and that's why that is the right option. Third option is you should explain the reason to the patient, and you have the ethical right to refuse referral. No, you cannot refuse referral. And D is none of the above. So the option is B, that whatever my conviction is, whatever my principle says, doesn't matter. If the patient wants a referral, I should refer. Because it may happen the patient has heard of some other extraordinary option from somewhere else and he feels only a specialist can do it, and maybe I'm not updated by it. I cannot just refuse a referral, you know. So yeah, that is what this question means. Read the ethics document. I think I've uploaded that on the Facebook, and for all the enrolled candidates, it's there in the Google Drive that I will share once you're enrolled. I hope this is clear. Please read more about erosion, abrasion, attrition, abstraction, and you will definitely get one of these questions and at least 5 to 10 of ethical questions in your exam. How's the preparation going on? I hope everything's good. Hope to shoot another video soon, and take care. Bye bye.